Scott County, providing safe, healthy, and livable communities.
On to Scott County Delivers. We're talking today about aging and disability services. So Chris Harder, you're going to get us started, I bet.
To talk about the services that the county provides to our most vulnerable residents. And a few things I just want to say to start us out. We are going to talk about our aging population, and we are going to talk about our population of people who live with disabilities. And those are two uniquely different populations, and we have some discussion and some data for each of those populations. But they are served by a very overlapping common service array. And so many of the services the county provides serve both of these populations. So we'll hope to be clear in our questions if we're talking about aging residents or disabled residents, but we certainly welcome your questions around that. In terms of the information on aging residents, much of the services to our aging residents happens through community partnerships or insurance programs. And so I think a lot of the information you're going to hear today about the aging population will be new. The data, at least, will be new. In terms of the information on disability services, that is data that you have seen before and discussions we've had before. For today, I think it tees up some future conversations that this board will have with our HHS partners around MnChoices and around some strategic planning around disabilities and services to aging residents. So today is kind of a kickoff for that. We certainly welcome any questions, want to hear what you'd like to know more about as we move into workshops in a few weeks. So with that, I'm going to ask the facilitators to introduce themselves. Then we'll ask each of you to introduce yourself and who you represent, what organization you're with, and then we'll get started.
Good morning. My name is Scott Haas, and I'm the Director of Emergency Management and 911 Communications.
Good morning. I'm Lori Huss. I am the Employee Relations Director.
Good morning. Jake Grusing, Transformation Enterprise Services Director.
Good morning. I'm Shona Biskins, and I'm with the MnChoices Assessment Team.
Good morning. I'm Peter Goldstein. I work as our Health and Human Services Housing Supervisor with Scott County.
Good morning. I'm Terry Hassan, and I represent the Scott Carver Dakota CAP Agency.
Good morning. I'm Terry Steer, Chief of Police, City of Belle Plaine.
Hi, I'm Paula Lafreniere. I'm the Adult Services Coordinator at the Scott County Library.
Good morning. Brittany Lane, Manager of Aging and Disability Services.
Sarah Madsen, Volunteer and Community Coordinator.
Patty Freeman, the General Manager for Scott County Clerks.
And Alan.
Alan Herman, Transportation Services, Mobility Management.
Thank you. Thank you, everyone.
All right. I think I'll start the questions off, jumping off of what Chris had done in the introduction, to ask you to elaborate a little bit more about all of these different programs. There's so much in this packet and so much important work. How do you all interact, intertwine, kind of come together with your services? Where do you touch, and how do you serve together the people that we are talking about today?
That's a great question, and I think part of what we're learning and even bringing this information forward is that we each do touch serving people that are aging or people with disabilities. We each have a role to play, and so bringing this information forward, we're figuring out what are those intersections. I'm not sure that we've fully explored all of that, but that is part of what's written in our next steps, exploring that further so that we are making a intentional and strategic plan moving forward for how do we work together best, because aging and disability populations in Scott County, that's a really broad and wide topic, and it will take all of us to do a good job.
I'd like to take us to page 21. So in this slide, we're looking at the client ratings of county and contracted case management services. So two questions. First of all, the easy question, do we know, hopefully it's the easy question, do we know what the reason is for the reduction in responses we're receiving to the survey? And then a follow-up question to that is looking at the 4 different organizations that are working through these assessments, what are the measures that are used to actually assess the contractors doing this work? So how do we know that they're being effective in the work they're doing?
Slide 21, this is specifically about waiver case management services. So this is separate from MinChoices. MinChoices, that team does the assessment. It moves on to a waiver case manager. Currently, in 2023, you can see there were 5 contracted case management agencies we were using along with Scott County staff. And so your first question was about why the reduction in responses. I'm not sure. Where we're gathering this information from, this is an annual survey that we send out to all of the people that have received case management services, and they're asked to rate their level of satisfaction on a variety of topics. In 2023, we did switch a little bit. We adjusted how we were administering the survey, the types of questions we were asking, and it was sent out more electronically than we had in the past. Historically, we'd done a mix of snail mail and sending out by email. I believe we did more of an electronic push this year. That might be why we saw a slight reduction, but that's just a guess. Your second question was about contracted case management and how are we...
What are the measures that are used and how do we know if contractors are effective in what they're doing and delivering what we expect them to?
Yeah, there's a few different ways that we're doing that. The data you're looking at in front of you, this is just by the people receiving that service. How do they feel about it? 2 of the contracted case management agencies, they were new in 2023. So I suspect some of what we're seeing in the data is them getting used to this, how we administer things in Scott County. But we do have support staff here at Scott County that we do routine audits to make sure that they are meeting all the compliance measures that we have to live up to. There is also a lead agency review. DHS does that every few years where they're looking at all of our work, and the work done by contracted case management is a part of that. So there's a few different ways that we have some oversight of the work they're doing.
Thank you.
What's the reaction to that? The data on the far right on that slide, that there's a real shift from the previous survey results for both, mostly for the contracted case management. What's the reaction and maybe next step based on that information?
Sure. My initial reaction was I actually feel quite pleased that the majority of respondents are saying the service is average or above. There certainly are a few that stated it was below average or poor, but I actually thought it would be higher. So this I am pleased with. The other reaction is in 2022, it says there were 2 organizations under the contracted case management measure, but I know that we only received responses from 1 agency. So 2022, really it's responses from 1 compared to 2023. We got responses from all 4, 2 of which were brand new. So that to me says we will take a more targeted approach in the support and the training that we're providing to them. Because it matters. It matters because Scott County is rated on this, whether our internal staff are providing the service or our contracted vendors. So it would be wise of us to make sure they have all the support that they need to do a good job serving the people that live here.
I'd like to go to page 15, please. And my question is, what are some of the greatest challenges for those trying to live at home? Did I go to the wrong page? As I see. Your goodness.
Well, I would say that the house that they bought when they were young and working and capable sometimes no longer suits them. So they have steps, they have things that they didn't envision that would happen to them. I mean, we all know that we're going to be aging, but when it really happens to you, no one can predict usually with certainty what health challenges you're going to either inherit, develop by accident or through, your job. Also, the income that is needed to sustain today's lifestyle has been greatly compromised. I work with primarily seniors now, But I used to do SNAP outreach, so a lot of people, it's very sad when you get a call from somebody who's 96 who has to apply for food stamps for the first time in her life. She never thought she'd outlive all of her savings, her income from Social Security, which half of all seniors are just living on Social Security, which of course is dependent on your either lifetime of work earnings or your spouse's earnings. Medicare premiums have gone up. Of course, you know, cost of living, the housing, rents have really, people can sometimes control their mortgage payments, or hopefully they don't have a mortgage anymore, but you can't control the insurance, which has skyrocketed for their homes, and then the taxes, they have no control over that. So I see that with a lot of the seniors that I help. They're asking for help with home modifications. They're asking for help with, you know, cleaning, yard work, all that type of thing. But then I refer them. Sometimes they want to, sometimes they don't want to apply for other services such as the food stamps, used to be a Medicare counselor, Medicare savings programs, you know, all that type of thing. So I try to energy assistance. I try to get them to utilize all those other county or community programs and help them apply. But sometimes they're a little reticent about that because they never envisioned that they were that person, you know. So then I have to try to destigmatize it and saying, well, Medicare and Social Security, which I've never known anybody to turn down. That's from the same government as these other programs. So hopefully that's a little bit of a help. But they didn't know that they were going to outlive even people that had professional jobs, nurses. I mean, a lot of people that you think would have like that plan in place, it kind of evaporates when reality hits. So.
Terry, can I clarify? On page 13, there's a list of seniors served through CAP, and it shows a total of 4,106 seniors served. So in that first column, the EAP, what is that? We should have included a wordage around what that acronym means.
And then, so that's all of CAP?
What is EAP?
Oh, Energy Assistance Program.
Okay.
Yeah, and that is a federal program, but what happens is that we get the grant through the Minnesota Department of Commerce, and then we cover Scott Carver, Dakota, and I used to be an energy assistance worker. So that is based on income. It is one of our highest income eligible programs. It's not based on the federal poverty guidelines. It's based on the state's median, 50% of the state's median income.
Okay.
So they get help with utilities. If they're homeowner, they could get furnace replacement or repair, and then weatherization.
Sure. Chief Steer, I think Lori asked such a good question about just the challenges that you see in working with the aging population. Did you specify aging, Lori?
I was asking just about staying
Generally,
at home.
just
For
in those
whoever,
challenges for staying at home. I'm wondering what, you wrote some nice things in the narrative of this document. I'm wondering if you could talk a little bit about that.
Sure. So unfortunately, the time that law enforcement interacts with this population is usually a bad thing. It's either a medical or a maltreatment. It could be that they were a victim of a fraud. So we're trying to change that in the city of Belle Plaine by doing things like Coffee with a Cop. During COVID, we started a vulnerable adult checklist. I know we should probably change the title of that, but we identified the aging population and those with disabilities in the city, and we would check in with them during COVID to make sure that they were taken care of, that they had their medication, that they had food and water. And we still do that today. So some of the officers in the city will go around to those homes and put a puzzle together with them. And sometimes that's the only interaction they have with another human being for a week. So the officers actually took this upon themselves to do. This wasn't a direction from me. It was just something that they started. So we're all going to get there at some point. Nobody in this room is getting younger. So the programs we start today will affect us when we get to that age.
Thank you.
It was striking to me in the write-up on page 2, your second bullet point, where you wrote about Coffee with a Cop and police meeting monthly to answer questions. And the part that really resonated with me was listen to stories from the past and let them know we're here for them. And in other Scott County Delivers conversations, we hear about the lack of youth connection to caring adults. But it's probably, I mean, you just made me think it's probably everybody in our community that needs the people who are interacting with them to let them know we're here if you need us, and there are people in your community who care about you.
Right. Yeah, that's the thing. I mean, we're dealing with the greatest generation of all time. So when they say, they tell you a story for the third or fourth time, it's the same exact story. You listen to it like it's the first time, and you laugh at the jokes. And I mean, that's what we're here for, so that we build that connection with the public. And it's not just the aging population. It could be a young kid that sees us interacting with a older person and comes in and joins the conversation. So I do think that it's a way to build the bridge.
I'd like to jump to page 32. We hit on something talking about difficulty of staying in homes as people age, and it seems like a related slide, so I want to focus in on that. So looking at this data and the share of households paying more than 30% of their income for housing, how are we assessing this, and does that include just things like a mortgage, or does that include things like mortgage, taxes, and HOA, all the costs? As we talked about, mortgage rates may be locked in, but insurance costs for everyone are going up significantly, and that's having a huge impact on people's capability to pay their rent.
So this slide and the one immediately afterwards, right, I think they fit together so well. One is going to specifically look at those that are renters, whereas this one is broadly for all Scott County households. It is typically inclusive of all of those housing expenses. So if you're a renter, it might include renter's insurance. If you're an owner, it might include ownership costs. We would look to ensure that utilities are included within that, and it's generally a measure of the typical rates that people are paying both in mortgages and in rental amounts, as well as the kind of typical income ranges that a community might hold. And so that's how Minnesota Compass comes up with the data available on that first form. Seeing the insurance rate increases, we recognize that that's going to be something that is going to hit hard probably in 2023 and 2024 numbers. I think we're hearing a lot about it in affordable rental communities as well, as it's making it increasingly more challenging to get some of those subsidized rental properties up and off the ground.
I was talking to a retired person who lives in my neighborhood, and as we were talking about just how expensive life is getting, they were talking about their HOA dues that they pay, and how when they purchased their home, that homeowners association fee was somewhere around $100 a month, and now they're over $400 a month, which is a huge increase and something they simply can't control. So what's the future look like for these services we're delivering, and what do we expect to see when we see the 23 through 25 numbers?
Well, first I want to uphold that through the latest legislative session, we had some opportunities for some newer mechanisms of homelessness prevention and housing retention resources. And I think as we move forward into the next year, there will be a lot of conversations and some very real intentionality to ensure that we're deploying them in ways that make sense to meet the needs of our community members. I think ensuring that there are opportunities for homeowners will really need to be an area of focus, whether that's folks who might struggle to pay for their taxes, might struggle with some of those insurance costs. We're going to have to consider those as we would have otherwise just focused on mortgage and rental expenses. And it's going to be a challenge, so I'm certainly not here to shortchange that. But I think we are excited to see some of these new opportunities come to Scott County to be able to deliver new programming, or ensure that the programming that we're offering today can be a little bit more robust to meet some of those rising costs. Certainly not here to suggest that they'll meet them all by any stretch, but again, I think there are some cool opportunities on the immediate horizon.
Thank you.
Insurance, though, is going to be a topic for all of us across the country as we think about what the future will hold.
I would advocate for more senior housing, just because I talk with so many people that when I ask what their income is, and then I do ask what their rent, I mean, I have people paying 80% of their social security for their rent. And I'm like, you realize that's not sustainable. And so their living is really compromised, their daily living. They're really cutting out of a lot of things that are essential. So then I try to advocate for other things. A lot of them don't want to move. They like where they're living, even if it is a really expensive apartment. It's probably friends are there. They got used to it. It costs a lot of money to move. I just had a call yesterday. We're asking if I help moving. We don't do that. So our help is to really help seniors age in place. But we do recognize that sometimes it's just they cannot afford where they're living. Some of them have high assets, so their savings is high. So they're using their savings to supplement that rent every month. I said, you realize you're going to run out of that. She goes, yes, I know, in 4 months, in 4 years or 4 months, whatever. So some of them are planning and some of them aren't. So I do think we need more. I think the housing to be built, I know that's more time consuming, but then it would be built for seniors. So that would be really optimal if we had more of those 30% of your income for your rent. But even the voucher system, I mean, that could be expanded. I mean, then they could live easier where they are. So that seems to be what I see. The biggest cost is housing.
What are some of those other impacts when you see people who are just surviving and not thriving because of that cost?
Well, to brag, I mean, my daughter's a pharmacist, so she sees people cutting back on their medications. And I tell people when I used to do the SNAP outreach, you can take all your medicine you want, but if you're not eating healthy, you're not going to be a healthy person. So they do cut back on, food, they come back on their medications, they cut back on things that it's really we would consider essential. So I sometimes can do a budget with them, but sometimes there's not a lot of wiggle room, and that's when I try to get them, if they're eligible for these other programs, and that takes a little bit of time, but I can help them do that.
We go to page 26, please. So we have the screen to the adult protection reports screened in, and we have 20, 16, and 17%. And then on the about this measure on the left, it says the national average is about 59% screened in. Are our numbers good? Are they bad? There's no reason to assign any value to them, they're just accurate? Can you explain sort of where we are and what that means to you in comparison to that national average?
Sure. Thank you for bringing up this question. What does this mean? What you're looking at is this is the raw data. It is what it is. This is factual. So over time, let me explain the graph first. The blue bar, that is representing just all of the reports that Scott County has received through the MARC system, which is the Minnesota Adult Abuse Reporting Center. Every morning, the adult protection and the intake team, they meet to screen all of the reports that have come in. There is set criteria by the state of Minnesota, set criteria for what meets, we call it now an assessment, for our staff to go out, respond, assess the situation and determine if they need help or an investigation. And so that's the blue bar. The green and the yellow represent what we've actually screened in or determined it requires some type of response. It depends on who you're asking, Jake. Is this good or what does this mean? Our screen-in percentages have been fairly stable, I would say, over the years. But what the state of Minnesota is, there has been a philosophy shift. There's been some legislative changes, and what they are requesting of us now is to offer a more proactive and protective response, whereas historically we were doing investigations, we were determining who was at fault or if there was someone at fault, and also providing protective measures. So as the state moves us to or changes that philosophy, there's been a lot of talk about getting the state of Minnesota closer to that national average of 59%. So if we're currently sitting at 17% of screen-in and they want us closer to 59, that's a real big gap. And so I think there's good conversation and exploration to do there around what is the county's role, and if we are to shift in that direction, what would that take?
Thank you. Yeah, and Chief Steer, go ahead.
Yeah, I was just going to say for our city, whether it's screened in or screened out, just like child protection cases, we investigate every one of them. So we like the help of the county, but we will investigate any report that comes in.
So you're going out on all of these?
We do.
Okay.
All right. Brittany, can you, I think your team has done some good work this year around setting some performance markers and some data that we'll be able to bring to the board next year around timeliness of responses. Can you just describe that work and the direction you're going with that?
Sure. At the state level, so with the state of Minnesota, they don't have any requirements on time as far as how quickly we get out and respond. The state guideline is that we begin an assessment within 72 or 24 hours, but how they define beginning an assessment varies. For Scott County, what we've determined is it's important to get out there and actually see people and assess the situation, as opposed to making phone calls and coordinating with other people. Like eyes on first has been our priority. And so the last couple of years, we've made a decision that we want to get out there within 3 days. So historically, it has been, we're going to attempt to do that. Sometimes people aren't home. These are adults, so they have lives, and we generally these have been unannounced visits. We're not planning, we're not calling them and coordinating a visit, so we just show up. That is successful some of the time. What we are switching that to in 2024 is that our measure will be that we're actually completing those within 3 business days rather than focusing on just the attempt.
Nice. And how does that land for you if their timelines shorten? What's the capabilities or the capacity of the law enforcement partners to respond?
So we just respond immediately to the call. We'll work with adult protection on the case to see where we're at, so we don't interfere. But I just feel a need that we have to get out on that call right away and at least talk to the reporting party if they're not anonymous, but check on the person and report back to adult protection. So we do work together very well. If it turns out to be a larger investigation, having adult protection on your side is much easier for law enforcement. They have access to more reports and data that would take us the court process in order to get. So working together is always a better solution for law enforcement and adult protection. But.
Thank you.
Just one more quick follow-up. Does the police response vary by department or jurisdictional area, or is that pretty standard in what happens with those blue?
I can't speak for any other chief, but I know there are chiefs that will respond to all of them. And there's just some that will rely on adult protection. I think it's based on maybe the population and size of the city and whether or not they can free up a detective to go out there and look. But in my department, we train everybody in field training to be a detective. So there may be a time when you're by yourself and you're going to have to handle every case. So when you're going through field training, you're learning how to write a search warrant. You're learning how to investigate, photograph. So the officer that is on call that gets that can respond to the house and take care of it.
I'd like to move us to page 23. We haven't heard from Patty yet. So looking at the data of what's defined as underutilization or overrepresented populations in the parks, is a big part of that just the proximity? We see that people who are in Prior Lake, Spring Lake, Credit River Township are overrepresented in use of parks. But knowing that we have really Cleary and Murphy and Spring Lake parks that are these really well built out, amazing parks that are accessible, is that what's skewing these numbers, or are there other factors that would show why certain people are attending parks and not?
Yeah, thanks for the question. I do think that that's a foundational piece of it is proximity. There are other factors involved. So if you have a playground, for instance, at a park, you're probably going to attract younger kids. If you have a park with only miles and miles of trails but no benches and accessible parking, that may have an influence on who's going to come visit. But I do think geography definitely has
Patty, just as a follow-up, so this data is pretty old, but can you talk about why we included it in this packet and what it says to you about the populations we're talking about?
Sure, absolutely. So generally speaking, we at Scott County Parks, and this is not different from our sister organizations across the metro, don't have readily available demographic information on who's using our facility. So when people walk into a park or a program, we're not asking them what what's your income, what age are you, all that kind of stuff. And there's an opportunity every 5 years where we do a really in-depth study. So our partner, Stewart Ridge Park District, does that every 5 years. So the last time we have that data available is from 2018. The visitor survey was implemented last year. It's an immense amount of data, and it's all analyzed in-house at Three Rivers, so they're still compiling all the data, looking at it, and generating reports. So I'm hopeful towards the end of 2024, we'll have the 23 data. We'll be able to compare it to the 2013 and 2018 and see what kind of trends we're seeing.
So am I right when I look at this data to say that aging residents and residents with disabilities we're neither underrepresented or overrepresented?
That is what the data was telling us in 2018. Yep.
Thank you.
Can we go to page 29, please? So the numbers, the numbers over that 5-year span, that change is significant. So I just wanted to know if you could talk a little bit about some of the drivers. Are we looking at just the number of people are changing, just the costs are driving those numbers to change so much? Is it a combination? Just from your varying perspectives, what's driving that large number change?
What I can say, this is a slide from our income maintenance department. They are not on our panel, so I can't speak to this specifically, but I believe what they have shared is that due to just the growth of the county, we are anticipating to see that these numbers are growing. Okay. Go ahead.
Barb? Yes.
I would say also due to the pandemic and the fact that we weren't doing the redetermination process.
So can I, just to follow up, so if it was symptomatic of the pause on redeterminations, do you anticipate that this data is going to level off?
Yeah, we are starting to see those numbers come down. I think if you compare where we're at from 2020 at the beginning of 2020, I think we're still up about 20% of the number of individuals to what we saw at the peak of the pandemic, and actually at the end of last year. I think we have a slide in here somewhere that says 31,000 individuals that were on token assistance. I think that number as of last month was 22,000 individuals. So we're seeing that come down. I think some of the work still remains within that area because they're having to go through really about 3 different processes right now as they try to go through that redetermination process. I'm hoping that levels off by the end of next year. I think one of the things that with this slide though that you're going to see is you have the number of individuals that have a disability and the expense that's related to that. Like that continues to stay probably pretty steady. Once individuals are, it is hard to get deemed as having a disability enough to have waivered services. And once they have that eligibility status, they tend to stay with that. Where we're seeing the decline is in the number of people that are like the single adults that are still eligible.
Thank you.
It's not.
Is it really
Okay. I'm not a medical expert. I used to do for 1 year, I was an Affordable Care Act. I was a MNsure navigator. And then through my experience, I mean, this made perfect sense when I read through this, that disabled people would have more medical expenses, same as for the elderly. The thing too is I think there was a pause from the pandemic that they didn't make people re-up their medical. And so same thing for SNAP. We saw the big cutoff when the pandemic declaration had ended. A lot of people were really hurt by not having that full benefit of the SNAP amount each month. Mm-hmm. So we've seen a surge in our food shelf. The numbers, I mean, it's really, really hard to overestimate how many people are coming now to our food shelf. It is a safety net because they're not eligible income-wise with SNAP. maybe they're not old enough to get our home delivered meals, but they can come to our food shelf. Anybody in Scott County can come to our food shelf. We don't, we can ask them their income, but there's no barriers to that. So we're seeing like a couple week appointment out for the food shelf, but they can have the drive-up service that was the model that was implemented with the pandemic. So that can still be same day. But this was not surprising to me because so many people are needing of health services and with the disabled. I mean, when I get to see from the waiver people that are sent to me that CHOR typically tries to help people that are not on a waiver, but then we can utilize because we get reimbursed by either their insurance or the county. I get to see some of their plans, their life choices plans, and they have a lot of disability codes, things that they really need help with, and all those professional services are expensive. So that makes sense to me. My workers that work for me or my volunteers, we don't train them on mental health issues. We don't train them that. They're there to clean. They're there to clean the snow. But I do tell them, try to be understanding. You don't have to take abuse. People can be crabby. Maybe they, are feeling well. But they do have a lot of issues, so I try to mitigate that for them. But when I read through this Sunday, I could definitely see everything seemed to make sense to me. And then when you were talking about the caseloads and people being, why there was a gap in services, I could see that. They had a lot of retirements, you have new staff. It takes, just speaking from myself for 34 years, it takes a long time to develop skills, and you're not going to know everything on day one. And there's things that are not taught to you that you get to learn being on the job, so I could see why this would make sense.
Thank you. I think central to a lot of this, the material in these packets, is some of the challenges surrounding MnChoices. And so if we could go to page 16. I think the narrative spelled out some of the challenges around meeting the demand for service. But I wanted to give you a chance to speak both to the demands, and I thought there were some really strong examples of efforts to mitigate the demand through some of the reorgs and cross training and some of the things you're doing internally to try to manage that. So on page 16, this is a breakdown then of what are the new assessments coming into MnChoices as well as the reassessments. And so can you talk a little bit about that?
Sure. I want to clarify one thing in the about the measure section on the left. The language says here that an assessment takes 8 to 12 hours to complete. That was for MnChoices 1.0. For the current MnChoices 2.0, it's more like 15 hours. So I just want to clarify that part first. What you're seeing in the bar graph, and you will hear a lot more about this in a board workshop in July, but what you're seeing on this bar graph is the number of annual assessments we complete. Once a person is eligible, they have to be reassessed every year. So the blue is showing how many reassessments have been completed. The gold is showing the brand new assessments. We've gotten a new referral that's come in. The gold is really dependent on our internal capacity. We have to do the blue. We have to do the reassessment so people don't lose their eligibility. If we have time currently, that's when we've been deploying our efforts to doing those new assessments. So this graph doesn't show the full what the need is. It's just showing what we've been able to complete.
What happens to the people that you can't assess?
Well, I don't think it's news, but we do have a waiting list right now. We have, Shona, what is the current waiting list?
As of yesterday, we're up to 281 people on our wait list, and we still have people from November of 2023 who have not been assessed yet because we can't get to them. The Department of Human Services has given us some priorities over who gets screenings before others, and that includes like individuals who are discharging from institutions. We have to get to them. We cannot say, we're going to put you on hold. Individuals who are currently in assisted living facilities who were they're probably under private pay status and now have run out of money. We don't want them to get evicted. We want them to continue to get those services and supports that they were getting. So those are a priority for us. And also individuals who are open to case management, and the individual now needs placement, and they have found a placement. We kind of push those through as quickly as possible to make sure that they continue to be safe. And then everybody else, it's how they fall on the list.
So 2 questions. One is, do the priority areas that the state set, like how does that land for your team and your department? Like, are their priorities our priorities?
Yes.
Okay.
And we used to be able to get out within like 2 to 3 days. We're now up on an average of 8 days.
Or the priority assessments.
Correct, for the priority assessments.
So then my second question goes, again, is what happens to these people while they're sitting on a waiting list?
Well, you will see that in our July presentation, but just in 2023, 175 people fell off of our waiting list because they either passed away, they no longer needed the services, they had to depend on families, or neighbors to help them until we can get out there. I'm trying to think of some of the other things that we have seen. Some individuals end up moving to another county because they can't afford to continue living where they are, and they move to another county, so we don't know what happens to them.
Okay.
And a lot of people, they just try to hold it together until we can get out there.
Yeah.
Like for instance, yesterday, and it's still fresh, we had actually a family who has been on our wait list since January show up to the HHS lobby refusing to leave until they were able to talk to somebody and get some support.
Wow.
And so thank goodness that person is eligible for developmental disabilities, has been deemed eligible. But the last part of that eligibility determination is our assessment, and we can't get to them. But someone on Melissa's team jumped in and talked to the individuals, started providing them with some resources that they can start looking at right now because they are certified disabled and they're open to medical assistance. And those resources are available to people who are open to medical assistance and don't need to have an assessment.
Okay.
And then they're going to be looking at potentially another program that does not require our assessment.
Okay.
Try to put a Band-Aid on it for a short period of time until we can get to them.
Okay.
So Shona or Brittany, talk a little bit about that extra time. You said that the time for assessments 1.0 to 2.0 has almost doubled. Is that good time? Are we getting additional information? Does that enable us to help the clients better? Can you talk about that a little bit?
No, that's not good time. This is additional time that the assessors need to spend on workarounds because the new tool that was launched has a lot of faults. And when they fix one area, another one goes down. And then sometimes what ends up happening is we stumble across it and it affects eligibility. So we then have to figure out what happened. We have to report it to the state, who then puts it on their list of fixes. And I'll tell you, when they launched in July of 2023, there were like 51 fixes on their list. After the first 3 months, it went up to 150 fixes. And it just continues to keep rolling. When they fix one thing, it affects another. And so there's all this additional time that the assessors have to spend trying to figure out what happened that may have affected somebody's budget. Because they have the right to appeal, and then the assessors have to go to the appeals to explain to the administrative law judges why the budgets went down.
Can we go to slide 22, please?
Jake, do you mind if I ask one follow-up before we move on? Can I do that? Thank you. I'm wondering, because one of the things I think was important in the narrative was that these waiting lists exist across the metro. This isn't a unique to Scott County feature. So can you talk about, like, it really does seem like a system level fix more than, a fix that your team is going to do, right? So, like, are there conversations regionally about, or legislatively, like what, it feels like a problem we're not going to outrun. So I'm wondering what your thoughts are around the bigger conversations. And maybe you want to save that for the workshop. Would you prefer to do that? I just thought of that.
I'll talk about it both times.
Okay.
There was some legislation that just passed in this last session that extended the initial timeline. The state guidelines used to be you had 20 business days to get out and do that initial assessment. That has now been extended, excuse me, am I saying that backwards?
Calendar
It was
days.
20 calendar days, now it's 20 business days. In addition, one change that has happened is the assessment is now good for 365 days instead of expiring after 60. That's important because that reduces some of the repeat assessments that we needed to do. So those are two good things, but the bigger piece that did not pass in 2024 was reducing the frequency of those reassessments. So right now, they have to be done annually. There was a lot of conversation about reducing those to every other year or something else. That would have a significant impact on staff time. That did not pass, but I'm hopeful that we'll continue to push that forward this next session. But maybe, Shoni, you can talk about what some of the system issues are that counties or the region are talking through, or DHS is talking with counties about.
The one thing that I want to piggyback on something that Brittany had talked about, the legislation passing. It still requires federal approval. We just can't implement it. So the Department of Human Services has to write up an amendment to our federal waiver amendments to make that request to the Centers for Medicaid and Medicare Services to implement those changes. And if they say no, then we can't move forward with anything. Okay. And that is a stopgap for us.
Important clarifier.
Yes. And that's a stopgap for us. To answer, I'm not sure if I'm fully understanding what Brittany's saying, but the counties, we have a Metro MnChoices lead agency meeting. We get together and we're always talking about the challenges we're facing, and we share tips and tricks on how we worked around some of those challenges. And then we provide it to the Department of Human Services to say, these are some of the things that are big challenges for us. We need your help. The Department of Human Services now has received a grant to have, I don't remember the name of the company, but it's PCG, to come in and evaluate some of the supports that are going on and what are some of the barriers and challenges that the counties are experiencing as a result of administering these programs. The Scott County participated in one of those reviews a year ago. Didn't really tell us a lot to make some significant changes, but there's now another focus group that's coming up where they're going to be talking about system changes and some of the barriers on presumptive eligibility. And so we're encouraging staff and also as supervisors to register to be part and hopefully selected to be part of these focus groups so we can make those recommendations to the state that this is how and what can make our jobs easier and we can get things done faster. One of the things that has been also challenging for us is last year there was a legislative change that was made that the TEFRA fees, the parental fees for individuals going on medical assistance if they were kids, that their parents didn't have to pay a fee anymore. And so that was really helpful to the families, but it also increased the amount of work because individuals who say, no, I don't want to pay that high parental fee are now coming through saying, yep, let's move forward. You know, it's time, we could really use the help. And so that is also increasing our caseloads. We've also seen in the past 2 years, 5 large assisted livings open up in Scott County. And while most of them will take private pay for the first 2 years, now they're getting to the end of their 2 years, and we've seen a huge increase in the number of elderly who are calling that need the elderly waiver to be able to continue to live there, and that affects us as well.
Thank you. All right, Jake, thank you.
Could we actually go to page 11 instead? Sorry. So one of the things that I didn't see, and I think there's probably a reason for it, there's a lot of information here already, so you have to put boundaries on the conversation, which may be tips like I'm going to ask a question that doesn't have anything to do with what was in the packet and the data. But as you look at the first goal you listed is preparing for growth. That's the goal you're trying to accomplish, bringing folks together. You're looking to the future. I think census projections, planning, okay, what does that mean? As our population ages and gets more complex, how do we serve those folks? What I didn't see anywhere in the packet was the impacts and supports and opportunities for all the caregivers for both of these populations, both people with disabilities and older adults. And I think as I look at, we're going to have more and more older adults in our community. There's opportunity there probably from an entrepreneurship standpoint to try to be creative, and maybe that's something regionally that should be looked at. And also just what are those three? I should just stick with my original question. What are the three things? The impacts on caregivers who are working in this space, both the folks who are paid to be caregivers and the people who are working. I imagine like the Terry Furmans of the world, just showing up with all their skills and all their gifts, doing what they can to make a difference for people. Folks like Chief Steer and his crew. So what are the supports for the paid, unpaid caregivers? What are the impacts on those people? And then what do you see as opportunities going forward as you've had these conversations for a few months to prepare for today? You get to know each other's programs, what's going well, what isn't. What are the opportunities for the caregivers in this space over the next 10 or 20 years?
I will just add, it's not something that has not been an area of focus. When we're talking waiver programs, there's a set list of services that are offered. Caregiver support is a small component of that, but previously in HHS, that's not an area where we focused on us providing that service. There certainly are a lot of community organizations that offer support groups. When we hear about them, we're sending that information out to staff so that they can share with those that they're engaging. But the community folks may have more to say about what is out there. That certainly is something that we will need to focus on, just even in preparation for this. The question about what happens while people are waiting, what we hear is they're relying on family and friends. There's that caregiver burnout piece. I heard 2 stories really recently about parents that have lost their jobs or at risk of losing jobs because they have to stay home and take care of their kiddo while they're waiting for more support. So there are a lot of impacts there. It is something we need to pay attention to. I just don't know if there's been a focused attention made from the county side yet.
Carol, do you see any of those caregiver supports in the work that you do?
Yes. Yep. I share information. We've got a couple organizations that I hear from that I always send right to Brittany to share with her team in regards to caregiver supports and great organizations out there. Normandale Community College has a great organization that works with the caregivers. I get a lot of requests sometimes for caregiver respite. So that caregiver needs to get out of the house because they've been there taking care of the family. Can you just give me 3 hours to go to the grocery store by myself? And I'll find a volunteer that will go and sit with them. But I think there is obviously a big need for that, and we're seeing that, I think, community-wide and partnership-wide, that there are a lot of orgs that are kind of starting up to help to fill that need.
Thank you. Jake, did you get your questions answered? Did you have more? You want to follow up on that?
No, that's good.
If it's helpful, I'll say, I think it makes sense too to just look even at our fish requests, right? We often see requests come in from community members who are identifying that they're missing work, missing opportunities for school or for increased ed as a result of some of these needs around caregiving. And we're seeing the impacts come out certainly within housing related requests, but I'm sure it's probably true for a lot of the programming that Terry might operate at CAP as well.
Thanks, Peter. Can we go to page 22? Paula, I was really happy. I've worked in Scott County a long time, and I was an interim library director, and I didn't know that any of these things were happening. And so I was really appreciative that you guys pulled this data together about those supports that the library is providing as part of that support network and that safety network. As your team thinks about the growth in the aging population, how are your teams talking about what kinds of services might continue going forward?
I think at this point we're looking at things like technology. I was interested in what Chief Steer was talking about as far as helping with computer literacy and that sort of thing. I think that's something that we could be it's very much part of our job. We are not techie experts by any means, but when people come into the library and they need help, then we do the best we can. And that is usually involving helping them get on and off computers and printing and all of the things like that. I think it's really important for especially folks that are aging, because there's a good-sized population that doesn't get online for everything. It's not part of their culture, really. I mean, the phones that they have, they don't understand. They just want them to be able to call in and out, and save some numbers would be good. So they may not realize or just don't think to go to technology, and technology will make it so much easier for them to get those services that they need and to contact folks. The phone books are like kind of a thing of the past, same sort of thing. So I think the technology angle we'd like to pursue. We also know that there are folks that can't physically get to the library. And so we started a program called Library to You. We focused on people that were living in assisted living facilities in particular, where perhaps their facility would be able to take them to the library, but it doesn't seem like that really happens. We don't see large groups of people coming in from any senior facility to speak of. Unless they are in the same building as the library, which a couple of our libraries are like that. So we're taking materials out to them. Then along came the pandemic, and that really threw a monkey wrench in that. We are slowly coming back from that, but we would also, at this point, we're piloting a program whereby we are using Kara Matson's county volunteers, or in the process of doing this. And we're piloting a program where the volunteers can take materials out and pick up from folks living in their own individual homes. It does not have to be, you do not have to be in a facility, which I think is going to reach those folks that can't afford to be in an assisted living facility, or maybe haven't gotten there yet, but they still have disabilities that prevent them from moving around. I think another thing is just connection with the community. I think that's really missing, and I would like to concentrate, I'd like us to concentrate more on that. It's great for people, again, who can come in, but what about the people who can't?
Sure.
Are there programs we can do online? Again, that technology piece, right? So there's a lot to kind of pick at and look at for what we can offer to folks. But we want them to feel a part of their community. They are a part of their community. It's harder for them to be in that community. So
that's great. Thanks. All right, I'm going to give one last question to the facilitators.
On the topic of our seniors and technology, as we looked at the narrative from Chief Steer, talked about law enforcement often ends up on the tail end of a scam or a problem. What's the opportunity that we have either with the interactions with law enforcement or in our libraries to help educate seniors about all of the ridiculous number of phone and online scams that are occurring? And as we talked about, as people's flexible spending is getting tighter and tighter and tighter, having just one victim of a scam could push someone from being self-sufficient to being in need of a lot of services. So what's the opportunity, and what does it look like now and in the future for an outreach opportunity to help prevent that victimization?
Well, from a law enforcement perspective, it might not fall into our category, but what I would like to do is have some town hall meetings where we can bring everybody together and go through just your basic 101 of this is a cell phone, this is how you send a text message, this is a scam. If it comes an unknown number, potential scam, what does that mean? Do you answer the phone? Just a very base level conversation, and then have those multiple meetings with people to explain, now this is a laptop computer. I'll use my parents for example. It's hopefully they're not watching, but it's like once a week I get a phone call of, I just got a scam call, or I have a warrant out of Texas, and it's like, no, you don't have a warrant out of Texas. It's just, don't pay the money. But those are 81 and 82. They worked hard their whole life, and they could fall victim to a scam of, send us $6,000 in gift cards, and to them, it's, I have to get out of this, I don't want to be in trouble.
Yeah.
Well, you're not in trouble to begin with, but how do you get the message out there that you're not? So I think it's going to take a lot of cooperation, and it's going to take a lot of people to bring people together into a town hall meeting, and we could do it online, but most people don't know how to get online. So it's going to be a challenge to try and get everybody together to try and fix the problem.
I was going to say now, unfortunately, with the cease of the local newspapers, I think there could be other ways to reach people. Most people still get a utility bill. They might not. Some people do have auto pay or they get it online, but we're trying to reach the folks who still get the paper utility bill. Maybe we could have a little blurb in there to talk about the scam. I mean, just you have to tell somebody sometimes 3-4 times before it will actually sink in. Sometimes, because I do work from home and I live with my daughter, my son-in-law, my 3 grandkids, and sometimes they're like, why are you looking up the Comcast phone number for this person? I'm like, because I'm in 411. They don't know how to call. So they're calling me in order to assess these. But I think that would be a good way to have that, what seniors are still looking at. If it's their mail, what if they can't come to the town hall? You know what I mean? What are multiple places that people, I know not everybody reads their utility bill, but I mean, they should. But I mean, wherever seniors are getting their information, do that so that they can see that. Because I have gotten the scam, and having a last name of Hassan, my ex-husband is from Iraq, and so sometimes I get calls saying, you're going to be deported. And I said, no, I'm not, So, I mean, they will, and it'll be the number from Washington, D.C. It'll say that I have back taxes. I have none of those. So I don't have to be fearful. And I even say, shame on you. Why are you doing this? You know what I mean? But they don't care, But I mean, they're thinking they're calling somebody who is an immigrant, somebody who doesn't know better. I'm going to be 65 this year. I've been getting a lot more mail, things that they think that would be pertain to me, free dinner, and then we're going to talk to you about Medicare. And I'm like, I know all about Medicare. I used to be a Medicare counselor. So, you know what I mean? I just throw those away. But I mean, a lot of people do fall for those, which is unfortunate.
I just want to add really quickly too, this is a topic area, as we've been doing some exploration of a potential 5-year plan for aging services. We've met with a lot of different departments, the county attorney's office. What we hear from Sarah Wendorf too is that these scams, they require so much staff time from law enforcement, adult protection, case management, but what I understand is they're very complicated to prosecute too. And so it would be in all of our best interests to do some more community education about it.
Prevention.
Yes.
All right. On that note, Madam Chair.
Thank you very much. This was a wonderful presentation. I think we've all been interested in learning more about this. We need to hear more. We need to make some of these connections that I think were made today. Colleagues, questions? Commissioner Ulrich.
I've got a couple radically different categories of questions, and one comment. Generally, listening, I think it would be an excellent scale topic if you had a topic of community resources for seniors. Not redoing this exact presentation, but pulling out what would be really key resources for seniors. I think that would be very valuable to scale. And I do want to compliment, and I've long been impressed with the Belle-Plaine Police Department, but I'm just wondering, Chief Steer, if you have an opportunity in your meeting with other chiefs to share ideas of what you're doing for seniors. I mean, that is really, you're being very proactive and taking great steps. Do you have an opportunity, or how could what you're doing there spread to all the departments in the county? How can we help?
Yeah, I think, so we have our Scott and Carver Chiefs meetings once a month. I can bring it up there and just get different ideas. And some of the things I'm doing, I'm stealing from other people. So I'm not going to say that I'm a big groundbreaker guy, but I know most chiefs, and they want to do what's right for their communities. It's just a matter of time and resources. So I have the ability to utilize my resources a little bit more than, say, a Shakopee or Savage. That they're going call to call. So we have more of an interaction with our public, and that's just the population. But yes, I would love to bring it up. I'm also on the Minnesota Chiefs of Police Association board, and I can bring it up at that state level. as well, to see if there's something that I'm doing that they could use, or I can bring something back.
Great. One other, this is for Shauna. I'm aware of type of situation where a senior would start off as private pay at a facility and be told they do take elderly waiver, but when the time comes, when they run out of money, they don't have a slot. They only have, larger facility may have 1 or 2 or 3 or 4, whatever, slots for elderly waiver. I guess I'm wondering, is there something that should be done when these facilities are being built? I mean, is there some way we can require a facility to have more than, a couple % worth of elderly waiver spots in their facility? Because you said, and I'm aware of it, where people be, living in this county maybe most of their lives, and then they run out of money and they have to move to Hennepin or Dakota County because that's where an elderly waiver spot is. What's the solution there, or is there anything we should be doing differently?
That's an interesting question, because several years ago, when the county used to contract directly with these assisted living providers, we used to say you have to take a minimum of these many people before we will contract with you. And then when the state took over the contracts per direction from the feds, that all went away. So they have the right to choose how many people they will take on public assistance. And it's very unfortunate, because even when we're talking to them during intake and they say to us, yep, we're now running out of money and we're told we need to call you because we need to get on the elderly waiver, and they're already living in the facility, we'll say to them, did you have a conversation with the facility yet to see if they will keep you under the elderly waiver? And they go, well, our contract says that they will. We've had historically conversations with these facility owners, and they'll say, our contract just says that we'll find a place for you, but it doesn't say that we will accept the elderly waiver so you can stay where you are. So a big facility may have another facility in a different county, and they'll say, we have an elderly waiver bed open there. If you want to use the elderly waiver, you'll have to move there. Yeah, it's totally out of our hands. We cannot tell them, if they want to open up private pay and then later go to the Medicaid programs, that's totally their choice.
So the elderly waiver will often pay for the services, and then when we look at those room and board expenses, that's typically through a program called housing support. It used to be called GRH, Group Residential Housing. And I think we're having a lot of intentional conversations internally right now around our contracting processes and how we can ensure that there's adequate capacity, not only within our financial eligibility team to process increased requests for housing support, but also to support the providers that are operating these settings so that they know what the expectations look like and how to ensure that these folks can continue to be able to receive that benefit set in those facilities. But yes, to your point, absolutely, we see an array.
Or what Peter was talking about too is that room and board piece. People think that the entire elderly waiver program is going to pay for their room and board, and we have to say that's a separate piece that you are responsible for. And then so sometimes what the provider does is to make up for the loss of going the elderly waiver rate from private pay, they'll increase their room and board rate, and they can't afford that. So that's many times when Peter gets involved, or our economic assistance program, saying, what can you do to help us so we don't have to move?
Really good question, really good answers, and that is a much bigger philosophical economy question that we are going to have to solve more. So thank you. Commissioner Beer.
Thank you. You kind of ended the conversation on scams, and that is taxing on local officials, staff. But it feels like it is becoming a much bigger to-do nationally. So are you aware of any movement that the feds are looking at? Because it costs all of us money. I mean, you take someone's life savings and all of a sudden the collective we are now standing in the gap. And I know trying to find those IP addresses in Timbuk3 are very difficult after they're bounced around. But are you aware of anything, any movement?
No, so the BCA, Bureau of Criminal Apprehension in St. Paul, they used to have a task force that you would send all frauds to, and they would just investigate it. And the pile got bigger and bigger and bigger, and the staffing got smaller and smaller. So now they're trying to bring that back up a little bit. Technology's helped us out a lot for sending out, like we have a victim of a fraud of the warrant scam. So then it would be Belle Plaine has one, Shakopee has one, now Maple Grove has one. So let's form it all together. The Fusion Center helps us with that. So all the information together, investigators working together. The problem is the IP addresses, and once the money's gone, it's gone. So you're looking at a victim, and you have to tell them, you know, you're a victim of a scam, which is the first hit, and the second hit is we can't get your money back. And if we do, we're tracking it back into a different country for the most part. So that is impossible to prosecute. So I think there's a plan in place. It's just not there yet.
I've seen some public service announcements for the Medicare. They said, do not give out your Medicare number. I mean, I think you need to do that more because seniors do, I mean, most watch TV, so I think they need to do that more and just letting people know these. We don't want to give ideas to scammers, but I think the ideas are already out. But anytime you don't recognize, I get a lot of people that want to call me for donations, and I say, can you send me something in the mail? So I can look it over. I don't want to give my credit card. I'm sure Operation Smile is a good outfit. I do contribute to different charities, but I said, can I get something in the mail so I can look at it and then I can write a check, you know, and that type of thing. So I think can't have too many of those.
Yeah. I think the scammers are, I mean, this is their job. That's all they do. So they're doing a lot of research and they're finding that person that just lost a spouse. And they're hitting them at the most vulnerable time in their life. And maybe family at that point is not around, and they know, like, you just lost your spouse. I know your son is going to school here. They're very convincing when they ask for money, and that's what they do. I mean, and if they get money, you get on the list, and then everybody's going after that same person is what we see. So it's, I would love to be able to stop it, but it's just one of the things that it's out there.
So there's no smart bomb that can sniff out that IP address yet.
I'm sure there is, but nobody's given it to us.
That is prosecuting, but that's my own opinion. Thank you.
I just have I have a lot of questions, but the one I'll just focus on is, are we monitoring the nursing homes and service providers to make sure that that they're going to be able to continue being in service and have the staffing in place to provide services to those people? I know staffing was a big issue. I know that the state increased the minimum wage, but I still hear about issues with staffing in our day services and our nursing homes. So do you see, is that something that we track and monitor, and what happens if that nursing home or facility closes to our residents who are receiving services?
Between the Minnesota Department of Health and our internal licensing department, there is a lot of monitoring of those facilities. Situations still occur where facilities will close or where an entity will have to purchase the full portfolio of another provider. I recognize that was a pretty big one for our communities that we navigated in the last 24 months. When situations like that arise where the folks are accessing county case management, I think there's a lot of coordinating efforts to try to find new facilities for those residents, and it doesn't always fall to the facility itself to do, unfortunately. In situations where those sites might be full of folks who don't have as many connections to services, it can be more of a scramble. I can confirm that we've seen both. But again, between the Minnesota Department of Health and our internal licensing, there are pretty frequent interactions with many of the facilities that we have operational in Scott County right now.
Well, I cannot speak to what happens with the nursing homes and their staffing. I can say that the Department of Human Services has changed as a result of being more person-centered. That with the assisted living facilities, it used to be only the facility staff who could provide services. They've now made it that an individual could have help come in. So instead of getting the one bath a week, because that's all their staff can handle, they can now have somebody part of their elderly waiver service plan, have somebody come in to give them a bath more frequently or to come in and clean their home. And then the rate that is being paid to the facility is lowered so we don't have any duplication of services. So that is a plus for people in the assisted livings, but it's no help to individuals who are in the nursing homes.
I have one more comment, if that's okay.
Yeah, go ahead.
I just want to make a comment. My daughter attends ProAct for day services, and the Readmobile goes to ProAct a couple times a month. And we ran into the staff person at the Shakopee Library the other day, and she was just so thrilled. That's such a big part of her life, is having the Readmobile show up at ProAct. So I'm glad that's a service that's out there. And yeah, so thank you.
That's all. Commissioner Wolf? All right, I have some comments, but I will share them in another way. Thank you to everyone. I hope we made some connections here, because this is an important, growing topic that I think we're all dealing with. Thank you for being here today, and thank you for doing this really good work.